Introduction. I'm Dr. Elizabeth Spurgeon, one of the epilepsy physicians here at Cleveland Clinic, and it's wonderful to be here today to talk to you about this important topic. All right, so I want to introduce the topic, by really saying the field of neurology is a very fascinating one, and but it is quite a puzzle. So many neurological disorders over the years, we have come a long way in how we look at neurological disorders, how we diagnose and how we treat, including epilepsy. We've come a long way in what we can offer and the workup that it entails. However, as you know, despite, medication and different treatments, there still may be quite a ways we can go. And some people, still work to experience optimal seizure control. So what else could we be looking at besides the standard of care treatment? And so this is why, sorry, let me back up. I was trying to get rid of this. There's a top bar at my screen. Oh, here we go. I can move it. Okay. So why should we focus on lifestyle changes in epilepsy? And so this is when you can imagine, we have the standard of care treatment, which includes many seizure medications, different surgical strategies, but sometimes seizure control can still be pretty difficult to manage. And so this is why looking at lifestyle changes could be important. And where do we currently know about these changes? So this leads me to the next slide here. Okay. And that's what I'm going to be talking about today, is really what we currently know about lifestyle changes in epilepsy. And I want to present to you the preliminary results of the review that we're conducting. And I'll tell you more about that as we go on, and so on. So the treatment of epilepsy, as many of you know, we have a long list of anti-seizure medications. We have a variety of surgical strategies, as well as neuromodulation, including RNS, DBS, VNS. Some of you may have heard of those terms, and that's not the focus of this lecture today. And we also have some dietary interventions. So just listing those, was emphasizing the point I made earlier that we have all these great standard of care treatments for epilepsy, but maybe as a supplement to those treatments, lifestyle changes could be considered. So what do we know to this date about lifestyle changes in epilepsy? So really, when we're looking at what we currently know, we go to systematic reviews, and systematic reviews consist of a very scientific analysis of all the research studies that exist on a specific topic. And so that's why systematic reviews can be helpful, because while many research studies could exist on a certain topic, we really have to ask ourselves, is this, is this scientifically well performed? Is it good quality research? Did they have enough people involved? And that's where systematic reviews can be helpful in determining that. So looking at different lifestyle changes, so yoga was the first one. There was 2 studies included in this specific systematic review, and it did show possible beneficial effects in controlling seizures, although no conclusions could be made. And as you can imagine, with only 2 studies that they looked at, it's kind of hard to make scientific conclusions. And then what about psychological treatments? So 24 studies was included in this review, with moderate quality evidence of improvement in quality of life, emotional well-being, and reducing fatigue. No conclusions could be made regarding seizure frequency, though. Then we looked at music therapy. So this systematic review included 12 different studies, and it did show that Mozart music may be beneficial in people with epilepsy by reducing seizures and interictal epileptiform discharges. So these are the discharges that you see on the EEG that are signs of epilepsy. And then finally, there's this other systematic review that looked at diet. It is well known today that the ketogenic diet does demonstrate effectiveness in seizure control. Most of these studies have been conducted in children, but there has also been shown benefit in adults. And there's also studies to suggest benefit in the modified Atkins diet as well, although maybe less effective than the ketogenic diet. And I'll get into this a little bit more detail later on. So, basically, there's a lot of moving pieces with lifestyle changes in epilepsy, and so they have yet to be kind of compiled in a nice fashion for physicians and patients to review. So that's part of our goal in us performing our own systematic review. There has been one review looking at non-pharmacologic interventions for people with epilepsy and intellectual disabilities. But as you can imagine, with these two criteria, it limits the amount of studies that could be included and looked at. So they ended up looking at just one study with a surgical intervention. So that's really not what we were looking for. So therefore, I'm going to present to you our preliminary results of our own systematic review that looks at all of these interventions together instead of in separate pieces. So, this is what we're going to look at, is mainly focusing on seizure reduction and quality of life and what evidence exists out there currently. So this was our question that we wanted to ask. What is the effectiveness of lifestyle modifications on seizure burden and quality of life in people with epilepsy? And so I'm going to go through, first, I'm going to start by going through our preliminary results and what we did. And then I'm going to go through a couple of these interventions more specifically. So the inclusion and exclusion criteria are listed here. So we really wanted to look at randomized and non-randomized control trials, as well as any type of prospective study. So looking at a population and following them forward with an intervention. So we excluded more, basic reports like case reports of an individual patient experience or a retrospective chart review, meaning they went back into the charts and looked at results. We really wanted trials that were started and moved forward. And we wanted to focus on adults during our, this initial systematic review because as some of you know, children with epilepsy, there's a lot of variety of epilepsy syndromes, and that comes into play in children much more than adults. And a lot of those studies were syndrome based. So we wanted to focus more on the adult population, at least to start out with. And so the studies we included looked at adults and children both. And then finally, we wanted to really focus on seizure frequency. That was a requirement. In order to include these studies in our review, we wanted to see if seizure frequency was a primary or a secondary outcome. And so this is kind of summarizing the process we went through to obtain the studies we looked at. And so we started with a very high number, and our system excluded duplicates, and then we ended up with 3,400 studies that we kind of manually went through and screened if they were relevant to our topic or not. And ultimately, you can see here, we ended up with 103 studies that we looked at, looking at lifestyle interventions in epilepsy. And so these are the intervention types that we obtained from our search. So as you can see, they're listed here, and I'm going to go through them in a bit more detail. And I want to emphasize that these are interventions performed along with the standard of care treatment of epilepsy. None of these studies looked at an alternative or a replacement to the standard of care treatment. These are all supplemental to be added to the standard of care with seizure medications or surgery and things like that. So to go into this with a bit more detail, So some of the studies looked at diet. So these are the following diets that were included. So ketogenic diet, modified Atkins diet, medium chain triglyceride diet. One study looked at Ramadan fasting. There was a category looking at supplements. So various studies looked at some vitamins or omega-3 fatty acids, probiotics. We also included an intervention called biofeedback. I will explain this more later, so I won't go into it right now. And then also any psychosocial or behavioral therapies, including cognitive behavioral therapy, acceptance and commitment therapy, and so on. We included music therapy, looking at some studies looked at the Mozart Sonata by Mozart, and then others looked at more interactive music therapy. I'll go into that later as well. Another category looked at meditation, yoga, and mindfulness. There was a variety that was looked at. I will be talking about this later as well. And exercise, so any type of aerobic or physical resistance training exercise. And then the ones to the right of this slide, as you see here, were studies that were looked at less commonly, but regardless, in our search, we located some studies looking at the following interventions here. So to summarize, all the interventions that have been looked at in epilepsy, just in general, what has been studied, these are the topics that have been studied. And this is showing how many studies were looked at in each of these topics in adults with epilepsy. So diet definitely being the most commonly looked at, followed by different supplements, followed by this biofeedback training, which I'll go into later, psychosocial behavioral therapy, music therapy, exercise, meditation, yoga, mindfulness. So kind of, if you focus on the left side of the slide, these are all categories that were looked at with at least 5 research studies. The ones on the right, as you can see, they only had 1, 2, or 3 research studies being looked at. So it's kind of hard to make conclusions with such a low number of studies. So, so I wanted to show you the type of study designs that we looked at. So the reason that we want to look at the type of studies that were done is to kind of get an idea of the quality of research that has been performed. So as you can see here, 42% of the 103 research studies did not have a comparison group. And a comparison group can be important to have because it gives us, it can compare to the standard kind of normal fluctuations that can happen. Seizure frequencies can go up sometimes, they can go down sometimes, even if someone doesn't change what they're doing. So it's nice to have a comparison group to kind of compare if it's a normal fluctuation or not. And so as you can see, many of the studies here, kind of all these different colors, did not have a comparison group. The gray did not have a comparison group, but these studies did have a comparison group. And what were they comparing to? So the blue represents comparing to another intervention. The orange is another type of research study where it's a crossover design. And then the green is, they were comparing to these variety of things. So either the standard of care epilepsy treatment, a placebo pill, or a sham intervention, kind of like a fake or replacement intervention, or a different variety. And so the participant characteristics, it seems like some of my numbers disappeared here for some reason. I apologize for that. I don't know what happened to that slide. It kind of got split in half or something. So my apologies, but how many of these studies looked at refractory or non-refractory epilepsy? So as you can kind of see here, even with the colors without, I'm not sure what happened to this slide, my apologies. But the majority of these studies did include patients with refractory epilepsy. So refractory epilepsy is the difficult to treat epilepsy. So our definition, it's usually when someone is on at least two seizure medications, and they're still having seizures. And so this is important to note because, we want to gauge what has been studied. And so it seems like the majority of these studies did look at patients with refractory epilepsy. And this was just to show, once again, my number disappeared here for some reason, but the majority of our studies were adults only, which makes sense because we were screening for mostly adults. So kind of getting into seizure frequency. So what do we know about these interventions' effect on seizure frequency? So when we were looking at all these research studies, we were screening for whether they did a statistical analysis. So what this means is, was the reported change statistically significant? Was it backed up by a statistic analysis or not? And so it looks like 75% of these studies did that statistical analysis to show that extra supportive evidence, while 25% did not. And you might ask, well, why did 25% not do a statistical analysis? These types of interventions can be kind of challenging to study. Many people can drop out during the study. It's kind of hard to recruit patients for these studies sometimes. Sometimes they end up with a small number of people within the research study. So that ends up not yielding very much for a statistical analysis to be performed. So that's why some of them did not do that. And so we looked at the ones that did do the statistical analysis, and 69% of the 77 showed a statistically significant reduction in seizure frequency. So then we want to look at, well, what were these interventions? What exactly? So this is our chart trying to display that. So out of the 77 studies that did that statistical analysis, these are the ones that had a significant reduction in seizure frequency. So as you can see at the top here, so this shows, oh, my apologies. This shows the number of studies, in the orange boxes, how many were significant reduction in seizure frequency over the total number of those studies. And then on the side here, you see the percent number of studies with statistically significant reduction. So this is the percentage. So as you can see here, the most frequent was biofeedback, meditation, yoga, mindfulness, reflexology, but keep in mind, this is only one study that was looked at. So kind of to skip over reflexology and look at diet, music therapy, and then to also highlight, many studies have been performed on psychosocial behavioral therapies, and, at least 60% of them had that seizure frequency reduction. So this is just to kind of highlight a couple of these topics here. The rest, you have to keep in mind, they may have not had a lot of studies conducted. So then asking about quality of life, not only do we want to look at seizure frequency, while that's important, many other things affect, people with epilepsy. So we looked at quality of life. So only 22 of these research studies out of the 103 measured quality of life. And out of those 22, 15 or 68% had a significant improvement in quality of life. So overall, it wasn't studied very often, but when it was studied, there was some promising results. So let's look at what interventions were studied. So the most common that looked at quality of life was psychosocial or behavioral therapies, and 100% of those where it was studied showed a improvement in quality of life. And meditation, yoga, mindfulness is also there to be highlighted as well. While the rest of these studies did not, have many research studies conducted. And, it's kind of interesting here to look at diet, only 1 out of the 5 showed a improvement in quality of life. And this may be because some of the diets are so hard to follow. So now getting into some specific interventions here. So I want to highlight the top 5 that we kind of looked at. So biofeedback. So this is the chart I originally showed about seizure frequency reduction out of the 77 studies that did that statistical analysis. And so, so I wanted to highlight kind of the top 5, but for time's sake, really kind of focus on the top 4. And so what is biofeedback? I'm going to go into that. Meditation, yoga, mindfulness, diet, and music therapy, kind of for the sake of time. And so, and I just also want to reiterate, this is the preliminary results of our systematic review. So this was more of the descriptive portion. So we're really kind of telling you what we see, but we even have yet to do our own statistical analysis. So to really make any confirmed conclusions from these research studies, comparing them one to another, we have to perform our own statistical analysis to see what is actually significant in also encompassing the quality of that research that was done. So that's kind of where we left off. And so that's kind of yet to come. But we want to go into these therapies a little bit more to describe what they are. So EEG biofeedback, it's also called neurofeedback or neurobiofeedback. And this is where people are trained to control their brain waves through a feedback loop. And so there's several different types, but the most commonly studied in people with epilepsy look at frequency or power neurofeedback. So this is when someone is actually trained to change the specific wave frequencies of their brain on EEG. And then we have something called slow cortical potential neurofeedback. And this is when they learn to change that specific value, a slow cortical potential, which has been an indicator of cortical or brain, kind of the cortex of the brain, excitability. And so this is a very complex field. I'm not going to go into it too much further than the basics because it would take a whole nother lecture in itself. But this is kind of an example of the first type. So this person is being trained on the EEG to learn strategies on how to kind of change these frequencies on the EEG. And over here is an example of the second type, the slow cortical potential. So they learn how to control this. So if they do something right, the rocket ship moves forward, and that's kind of the feedback loop. If they do something in the wrong or in the opposite direction, the rocket ship moves backwards. So that's kind of an example of how a feedback loop works in these cases. The other type of biofeedback that you might hear about is called skin conductance biofeedback. This is different from neurobiofeedback. And so this is also called galvanic skin response. And it's where a person is trained to control their autonomic system. Autonomic system is kind of fluctuations. It's kind of tied to our stress response or relaxation response. So as you can imagine, things you feel when you feel stressed include, maybe sweating more, or your heart rate increases, your breathing rate increases. And so this gives the participants a feedback loop on how to control these stress responses by showing them their breathing rate, their heart rate, and things like that. Let me just take a quick sip here. And so this is a picture kind of displaying that. And as you can think about, how is this important for epilepsy? Stress is a major cause or trigger for seizures to occur. So, the theory is that if we train, people to better adapt or recognize their stress response and then calm themselves down, would that affect seizure frequency or not? And there has been some promising evidence. I think there was 3 studies that looked at this in adults that showed some promising evidence. So now is a fun category here. So meditation, yoga, mindfulness. So yoga is a variety of practices which incorporate physical, mental, and spiritual exercises originating in ancient India. And so we have different ideas of what yoga consists of, in more modern Western practice of yoga. It's kind of like these, you would maybe envision for yourself a pretzel pose and very, very complex poses, postures that are focused on physical fitness and stress relief. And then other, more traditional versions of yoga look at more meditation components. So there's a wide variety, and that's why these were all three lumped together because of that variety. And so what has been looked at in epilepsy is quite a variety. So there were about 6 studies included in this category, and some include yoga with the postures and meditative component, and some look at more of that meditative, more meditation heavy. One study looked at Sahaja yoga, a meditative thoughtless awareness process. And so now I'm actually going to pause here and show a video example of yoga that is done at Cleveland Clinic. So we have a yoga therapist. We have a couple yoga therapists here in our Wellness Institute. And her name, particularly who I'm going to show, is Judy Barr. Unfortunately, she couldn't make it here today with us. We were hoping to have her talk to us in person, but we luckily have a video of her. So the reason I want to show this to you is that, we have many ideas of what yoga is, but I want to show a way that it could be. Some people have, joint pains or different physical limitations where this kind of modern day yoga may be difficult. But there is a specific yoga therapist who went training and who practice yoga for a wide variety of patients. So let me go ahead and show that video to you here. Let me see. I may have to reshare my screen. Are you seeing the yoga video by chance?
Yes.
Yes. Okay.
Yes.
I'm gonna play it. And please feel free to participate. It's a 4-minute video, and it's yoga while sitting in the chair. So it can be done at your desk or your office. So please feel free to join in as the video is playing.
Program manager for the Cleveland Clinic. Today we're going to talk about tension in our neck and shoulders. We spend so much time hunched over our computer, our devices, our desk, even at the dinner table, that many times we put strain on our neck and shoulders, which can cause neck pain, even headaches. I'm going to show you a few postures today that are really simple to do, any place, one or all of them, to help relieve the tension, to open up your chest more so that you can breathe better, and to think more clearly, feel better with your back. So the first one, very simple. And that's the beauty of these poses, is they're eloquently simple, and they really affect a lot of our different muscle groups very effectively. So the neck roll is we just drop our chin, we're just rolling from one side and dropping down. You might hear some popping, and that's okay as long as there's no pain associated with it. Just rolling and coming back. The next are shoulder rolls, and these particularly really help to loosen the tight muscles in the front, the side, and the back of our shoulders. So going and rolling along one way and then rolling the other. These two poses alone can be really beneficial and not a bad idea to do several times a day. The next pose we're going to do is called fan pose. Move as far forward on the chair as you can. Put your hands in the back of the chair and then just slide up as far as you can, leaning forward while still keeping your elbows straight. If they're bent, you're not going to get the tendons in the shoulders that we're trying to get. So pulling your shoulders back, it feels really good. This one is especially good to do during the day while you're working at your computer. And pulling your shoulders back, take a long breath in and exhale. So you can really see the ribs moving. And notice how much this opens the chest, which helps to counteract gravity. You take a nice long breath in and coming back and down. So the next pose we're going to do is primarily for your back. The idea here is as you cross your arm over your body, that the weight of the arm is in the supporting arm. This way, all the muscles in the back can relax. So pull it over as far as it'll go. Again, no pain in it. You may even want to look towards the shoulder. Take a big breath in. You feel a nice stretch back by your shoulder blade. Really a big tension point. Then take that same arm, and as if you're going to shake hands, take it behind you, and then bending from one side and a nice tall spine, always lengthening, and over to the other. This gets a big muscle that comes down our back called the trapezius. Doing the other side, same thing. Weight of the arm, pull it away, look even slightly, and pull. You'll feel a nice stretch in that shoulder blade. Take a breath. And then as you exhale, bring it around, hold on, or just put it back as far as you can. And again, go side to side. That's getting some edges of the muscles that get really tight in our back when we sit. The last pose is called stir the pot, and it's using gravity. Put your elbow or your hand on your leg and let your arm just hang for a moment. And then just initiate a circle. We call it stir the pot, and you see why. But it helps lubricate the joint, the shoulder. And it actually helps you to understand what it takes to release the tension too, by just letting it hang. And then, of course, you'll do it on both sides. So the big piece about helping to relieve the tension in the neck and the shoulders would be perhaps noticing it or making it a regular routine to do one or any of these poses during the course of the day. You'll see you'll feel better, you'll think clearer, be able to breathe, and have a more productive and enjoyable day. Thank you.
All right. So that was a video by our yoga therapist, Judy Barr. So just kind of a sample of what we do here. Okay, so let me, I'm going to open my PowerPoint again. And let me switch the screens. Okay, so that was a sample of yoga. So now I'm going to briefly talk about diet. So the diet has been studied, and the ketogenic diet has been studied much more frequently in children than adults, but it has been studied. 8 studies were included here that had looked at adults. And the ketogenic diet is a type of diet where the fat intake is increased while you restrict carbohydrates, proteins, fluid, and calories. So as you can imagine, with restricting all of those things, it's a pretty challenging diet to follow. And this can be done in different ratios. So typically 4-to-1, but it also can be 3-to-1, 2-to-1. And it's the ratio of fat to all the rest of these things here. And I believe I even saw a diet talk on the Epilepsy Association site, so that may be helpful to some people to look at. And so modified Atkins diet has also been studied in adults with epilepsy. And this is the type of diet where fats are encouraged, while carbohydrates are restricted, but there's no restriction on protein. So it's a little bit more lenient, a little bit easier for people to follow. And there has been some promising evidence with the modified Atkins diet, although not as effective as ketogenic diet. And then there's been a diet looked at, medium chain triglyceride ketogenic diet. And this is a diet that utilizes ketogenic oil. Less total fat is needed. More carbohydrates and proteins are allowed. And so it is more lenient. However, the ketogenic oil, or there's a lot of oil intake with this diet. So people can have the potential to experience some side effects from that, like GI, kind of stomach upset and things like that. So only one study was looked at in adults with epilepsy on that diet. So now going to another category where I'll have Dr. Gallagher chime in. So I just want to briefly introduce music therapy, and Dr. Gallagher will tell us much more about it. So it's a variety of musical interventions using an evidence-based strategy, and I'm going to save the rest for her to discuss. But what has been looked at with music in epilepsy? So music in epilepsy, the vast majority that has been looked at has actually been more passive listening. So listening to the Mozart Sonata for 2 pianos in D major K448. If we have some time at the end of the talk, I'd be happy to, play a recording of it from just YouTube to show you what it is. But basically, the reason this has been most studied is because it's been known for the Mozart effect. So it's what was studied in showing an improvement in IQ by listening to this Mozart sonata. And so studies have shown a decrease in epileptiform discharges, or those spikes or sharp waves on EEG, with exposure to this music. So that's why it's been studied in epilepsy with some promising evidence as well. There has been one study looking at the more standard musical therapy, incorporating vocals, instruments, and attention control. So I think there's a lot more room to be done in this field. And that's why I invited Dr. Gallagher to join us today to talk to us more about this. So let me stop sharing so that she can tell us more about the benefits and the goals of music therapy. All right, let me let's see, stop sharing. Okay, here we go. All right, Dr. Gallagher, I'll hand it over to you if you could also briefly introduce yourself as well.
Sure. Thank you, Dr. Spurgeon. I'm Dr. Lisa Gallagher. I am a music therapist here at Cleveland Clinic, and I'm also a researcher in the Arts and Medicine Institute. I just want to give a quick disclaimer. The office I'm using today, the internet is kind of wonky, so if I freeze, I'll be back, hopefully. So just wanted to give you that. The thing that sets music therapy apart from music listening or just music is it's a relationship. It's a relationship between a board-certified music therapist and the patient. And we work together to determine what the goals are, what the patient needs, what will help them the best. And, we've had a inpatient program here at Cleveland Clinic for 28 years. And then we've been doing some outpatient work as well in the cancer centers for over 10, 15 years. And then I have been doing some outpatient neuro work recently. And so I've also had the pleasure to work with Dr. Spurgeon on this epilepsy study that we're doing. And, so our goals with that are to improve health and resilience and well-being, quality of life, and decreasing stress. And what I'm doing with the music therapy is maybe reminding our participants of some old things that they used to do with music and teaching them some new ways to use music in their lives. Because we want to use it to help with decreasing the stress, which will hopefully also decrease the number of seizures. So we begin by talking about how do you choose the music? How do you find that music that is best? And we talk about the importance of preference, because research has shown that a patient's preferred music is going to be what is most effective for them. So we talk about using the music to maybe match the mood you're in. So if you're in a really bad mood or you're really angry, starting with something really happy and upbeat's not probably gonna put you in a better mood. So maybe you need to start with some music that sounds angry or matches that mood, and then gradually shift to something calmer. A great preference story I share is I did a study in college where I did hook people up to the little biofeedback monitors that just went on the finger. And, if the patient or the person that participated in the study was relaxed, I would get this quiet puh, puh, puh sound. If they weren't, I'd get this high-pitched screech. And so I hooked all these people up and got the quiet sound. And then I hooked up my roommate and it started screeching. And I'm like, what's wrong? And she's like, this is not relaxing music. This is not calm music to me. It makes me tense. And I said, okay, go get your favorite music. So she did. We played it and we got the quiet puh sound. what music was she listening to that was relaxing for her? Metallica. So I don't normally recommend heavy metal music as being, the preferred relaxation music, but for some patients, it is. So we talk about the importance of finding music that you like, your favorite styles, your favorite singers, how to use it for different moods you're in, and then finding music that doesn't have any negative associations. So you don't want to use music that reminds you of bad times, obviously. Then we talk about using music, maybe when you're exercising or cleaning or, for relaxation, for sleep purposes. We talk about finding your theme song. So what song is it that for you that motivates you and inspires you? For me, it's Stand by Rascal Flatts because it talks about, you might get knocked down on your knees, but you pick yourself up and you wipe yourself off and you keep going. And that's my motivational song. So we talk a lot about that and have the participants find their own songs that motivate them. And then we share them and talk about them. A big thing that has been coming out as we've been running these groups is that these individuals are saying they're not alone. Other people have the same experiences, the same fears, the same frustrations that they do. And so it becomes like a real support to them. We talk about intentional music listening. Listen with everything. Your mind, your body. How does it make you feel physically, emotionally, and then does it remind you of something? So we play a lot of different types of music so that they can experience it for themselves. And we find that, it taps into the physical, emotional, cognitive thinking, spiritual, and social aspects. We also talk a lot about stress management, obviously, since stress is a huge component to epilepsy. And we talk about how to use music and how to use different techniques. I go through very simple breathing techniques, several different ones, progressive muscle relaxation, relaxation response, and music assisted imagery. We even get our patients to engage with us in active music making, instrument playing and singing are a challenge because our groups are held virtually. So some of that doesn't translate well because if we all tried to sing together, you'd get a lot of weird waves because of the delays. So we make it work. We get creative with it. And then, I do songwriting with patients. We talk about, using songwriting as a way to express feelings from a very simple fill in the blank, my favorite things from Sound of Music. We have people share their favorite things and, we fit it into that. Or, creating all original lyrics. We engage in movement to music because we want to keep people moving and engaged in physical activity. Music, produces endorphins in the brain, but movement and physical activity also increases the endorphins in the brain. So if you use music and movement at the same time, you get a double dose of endorphins, which is fabulous. So that's just a very quick run through of some of the interventions we use and how we're using them with our epilepsy patients. And it's been great to hear how they've used the music and the stories they're already sharing about the importance of music therapy in their lives. So that's all I have for you. So thank you, Dr. Spurgeon, for allowing me to share for a little bit.
Wonderful. Thank you, Dr. Gallagher. All right. So that was just a beautiful summary of, what music therapy is, what the goals are, and what type of things you practice with the patient. So thank you so much for sharing that. let me share my screen again. All right, let's see here which screen I pick. Probably the wrong one. All right, let me just, sorry, I have technical difficulties with these type of things. Let me just share the other screen. Hold on. Okay. I'm assuming you're seeing the wrong screen, correct?
Yeah, we're seeing your Cleveland Clinic screen, Arts and Medicine.
Now you're seeing your screen that has the arts and medicine slide up.
Okay, so the full screen.
Yes.
Okay, wonderful. Sorry, it's a little bit hard to tell what Zoom wants to do. Okay, here we go. So yeah, so if you want, more information on what we do, at least at Cleveland Clinic, you can go to this website. There's arts, it's all about arts and medicine. It has some resources on it as well. And so to move forward here, so to overall summarize, I'm hoping you're seeing the right screen. I'm assuming you are. So to summarize, based on our review, what we have conducted, our preliminary review, more of the descriptive portion, we identified 13 non-pharmacological lifestyle type of interventions that have been looked at in patients with epilepsy. And the most frequently studied, as listed here, diet, a variety of supplements, biofeedback, psychosocial behavioral therapy, music therapy. And so our preliminary results, do show some promising evidence, although we have to do that more statistical analysis to come up with, more conclusions. But out of the 103 studies we looked at, there were 77 that did a statistical analysis. And out of those, 69% did show a significant reduction in seizure frequency. And these were the top kind of categories that had at least 5 research studies, and the top 5 that kind of showed that significant reduction in seizure frequency. And then out of the 103, only 22 did look at quality of life, but out of those 22, psychosocial and behavioral therapies seem to have the most promising evidence there. So what are we going to do next? We're going to do this statistical analysis that I told you about, potentially comparing interventions to one another or within the subgroups. And we're definitely going to do a bias assessment. So how, this bias assessment will look at the types of bias that may be done, that may have occurred in the research studies or so on. And so it's really just a quality assessment. And so the conclusions are that there is some promising evidence that certain non-pharmacologic or lifestyle changes could be beneficial in those with epilepsy. And clear challenges do exist in studying these. And as I mentioned briefly, these interventions can be quite challenging to study. But I think there's a lot more room for growth. I think there's many more areas in this study that could be looked at to potentially help those with seizures. And we need high quality, good research studies. So, we need good sample sizes, meaning the number of people included in the research study needs to be high enough to conclude significance. And we need to, report things as a community of researchers. We need to be consistent in how we report seizure frequency. As you can imagine, it could be studied, what's your weekly, daily, monthly seizure frequency, and there can be a lot of variety in how researchers report that value. And more randomized control trials. So this means, randomly assigning people to different groups and following them forward. Oh, my apologies. Sorry, my screen was pulled up here. I don't think you guys saw it, so that's good. It was something that popped up on my end. So more randomized control trials with control groups, with those comparison groups that we can really look at and do a statistical analysis on. And so, so what are we doing here at Cleveland Clinic? We recently kickstarted a research study called Creating a Healthy Life, Lifestyle Interventions for Epilepsy. And this is a randomized control trial with interventions with the intervention group. So, a single person will be randomly selected to one of the following groups. So someone may be randomized to yoga therapy, cognitive behavioral therapy, or music therapy. And we also have 2 comparison groups as acting as a control group, meaning the standard of care treatment for epilepsy, meaning, continuing on seizure medications and following up with their providers. And, to emphasize that these interventions are going to be done along with that standard of care treatment, and by no means replacing that. And so here are some resources from the Cleveland Clinic website. There is a wellness institute here. So some of those resources, like this yoga video, I did obtain from that Wellness Institute website with Judy Barr's permission. So you can go on there and explore more if you'd like. This is just a barcode for the references that I included from this talk. So that kind of wraps it up, and I'll stop sharing so we can open up for more discussion.